Hi, I'm Dr. Jones.
And I'm David. I have a heart condition called ATTR cardiac amyloidosis, also known as ATTR-CM. And Dr. Jones helped me understand that I have a form called wild type, which means it's age-related, but it can also be hereditary and run in families.
To understand ATTR cardiac amyloidosis, we first need to learn how the heart works. In a healthy heart, the muscle is supple. Its beat is strong and steady, which means you can go about your life being as active as you choose. When you have ATTR cardiac amyloidosis, things can feel different. The heart has a hard time keeping up because there's a problem with an important protein in your body that stops it from working properly. Let's go a little deeper to understand how ATTR cardiac amyloidosis develops. To understand how ATTR cardiac amyloidosis impacts the heart, we have to learn about an important protein called transthyretin, or TTR for short. TTR transports vitamin A and the thyroid hormone thyroxine, which helps regulate your metabolism. TTR is made up of 4 small proteins held tightly together through strong bonds. When TTR is working as it should, you can go about your life as usual, but sometimes TTR becomes unstable and the bonds break apart. Once the bonds have broken, TTR reforms into abnormal proteins called amyloid fibrils, and that's where the trouble begins. Amyloid fibrils move around the body until they find a place to settle. Eventually, the buildup interferes with normal bodily functions. When amyloid fibrils lodge in the heart, that's ATTR cardiac amyloidosis. Symptoms like tiredness and weakness, shortness of breath, swelling in the legs or feet, and other symptoms like carpal tunnel can make daily life increasingly difficult and may eventually lead to heart failure.
So what can we do about this? How can we keep TTR from breaking apart and stop amyloid fibrils from causing trouble?
Stabilizing TTR may help. Attruby is a stabilizer that works by strengthening the bonds that hold TTR together. With the bond stabilized, TTR is less likely to break down, which in turn means the amyloid fibrils that cause all the trouble are less likely to form. In laboratory tests, over 90% of TTR proteins were stabilized as early as 28 days with Attruby. And in a 30-month study, people treated with Attruby did significantly better than those not taking Attruby. Results were based on a combined measure of survival and hospitalization due to heart issues. They experienced a survival rate of 81% and a 50% reduction in the number of hospitalizations due to heart issues. They also saw an impact on their health-related quality of life compared to those not taking Attruby. In fact, an impact on survival and heart-related hospitalizations was seen as early as 3 months. Possible side effects include diarrhea and abdominal pain. For most people in the clinical study, these side effects were mild and went away, so they could continue taking Attruby. The impact of Attruby on health-related quality of life also included helping people better manage physically and be more engaged socially.
I've been able to spend time with my friends and family and just be more present. I've noticed the difference.
By stabilizing TTR proteins, Attruby may slow the progression of ATTR cardiac amyloidosis.
Attruby is working well for me, but you should talk with your doctor, and together you'll find what's right for you.
What is Attruby? Attruby is a prescription medicine used to treat adults with a disease that affects the heart muscle called cardiomyopathy of wild type, or variant transthyretin-mediated amyloidosis, ATTR-CM, to reduce death and hospitalization related to heart problems. It is not known if Attruby is safe and effective in children. Important safety information. Before taking Attruby, tell your healthcare provider about all your medical conditions, including if you are pregnant or plan to become pregnant, are breastfeeding or plan to breastfeed. Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. What are the possible side effects of Attruby? The most common side effects of Attruby were mild and include diarrhea, stomach area abdominal pain, These are not all the possible side effects of Attruby. Call your doctor for medical advice about side effects. You may report side effects to the FDA at 1-800-FDA-1088 or www.fda.gov/medwatch.